with our special guest, my own preceptor, my own fieldwork educator. This is also gonna be for those who graduated and wanting to go into occupational therapy, pediatrics, working with kids, clinical or school setting, because I've got the brilliant Bailey. Oh wait, I can say your name, right? Brilliant Bailey from Desert OT for kids. So, you know, if anyone's looking for, actually, I don't know if they're hiring. Never mind.
We're always hiring.
Oh, there we go. They're always hiring. Guys, they have such a long wait list. They need more therapists. They are in high demand. So if you are looking for a place to take your kids, this is a good place. So Miss Bailey will share tips on how to work for Desert OT for kids. No, just kidding. No, for pediatrics, clinical, or school setting. All right.
Well, I could probably spend hours on this topic, so we might have to do a video segment every episode.
Oh, we could do a season.
Yeah.
Oh boy.
The first thing I would say is, if you're thinking about going into the pediatric setting, first just check your heart and make sure that you have a passion for kids, and especially children with special needs, and serving those families and their caregivers and all their loved ones, because I think the most important thing that can't be taught in school or after school when you start working is the love for the children. So that is number one priority for sure, is making sure that you have a desire to help kids and their families walk through various phases and stages of life.
Miss Bailey has been in practice for
almost 4 years. Yeah, almost 4.
4 years.
Yeah, and I've only ever done pediatrics. This business is one that my mom created, so I grew up as a child going to the clinic and being sort of like a peer model. So I've always had a passion for children with special needs and have always loved them. That's what I think that's number one, because you can't really teach that. It's not really a skill. It's more just like a disposition.
From the heart.
Yeah, and I think if you have passion, then that'll drive you to be a really hard worker and create a really strong work ethic. So that's number one. Number two is you should be very aware of your temperament and your personality type. So being an OT in general requires a lot of patience and a lot of self-reflection and doing check-ins with yourself about your mood and energy and how that might impact your patients that day. But especially children, I have found, are very attuned to your vibes and energy. So making sure you know yourself, your strengths, your weaknesses, and how you're gonna approach that every day is really important. So being very patient with the kids and with yourself, being very understanding, being very observant of behaviors and skills and deficits. So always being very on the lookout when you're working with the kids and knowing what to be looking for. Respectful to the children and their families, that's a huge one. Really establishing the trust and rapport with the kids and their caregivers is huge from the beginning, because in order for the kids to want to work with you, they have to be able to trust you and feel comfortable trying things that might be challenging or uncomfortable. So definitely taking the time to build that therapeutic relationship and establish that rapport, however long that might take at the beginning of when you start treatment, that is important and should not be under or overrated. There's so many things. Be a really hard worker and create a really strong work ethic, which is important because the pediatric setting can be really demanding at times, especially if you do school-based and outpatient simultaneously. Both settings offer such a variety and difference in diagnoses and ages and other professionals that you get to work with. One of the things I love most about being on the school side of it is working with teachers and speech therapists and physical therapists and principals, and even just like the front office individuals who work at the schools. It's so fun to establish those relationships. So I think another thing that's important to be aware of if you have a desire to go into the pediatric setting is you're going to be working with a lot of different people every day. So be aware and willing to have lots of conversations and get to know people and be willing to talk to them and be willing for them to get to know you. And the more comfortable you are with people, the better, because those relationships are going to be very important and crucial to your career.
It's going to be continued, guys, because we are at our destination.
We have arrived to our school.
Yes, we're going to do some school assessments now. So remember, like and subscribe so you can see more Bailey too.
Oh gosh.